Welcome back to those who wanted a brief tutorial on the Chronic Disease Management SmartSet that I've put together. So definitely it's beneficial to have watched the video on the QDo Labs Do Smart Group. Helpful to watch the video on the Health Maintenance Care Gaps Smart Group before watching these SmartSet videos. So, and previously covered the annual wellness and the annual physical, but now this one will focus on the Chronic Disease Management SmartSet. All right, and so the tools, slowly working my way down, having some help videos, and this is where we're at of the smart sets that pull together not just labs, but pull together the opportunity to get a note, to get a diagnosis, to get a billing code, to get orders, instructions. So definitely an efficiency that's worth investing time in learning about and configuring. And so this will hopefully give you a base to start with. All right, so that was my qTools pop-up. I've mentioned many times right there. We'll get rid of that. All right, so I have this patient here for a visit. I've already kind of double-clicked from the schedule, and I'm in the chart. The nurse, I played nurse, put some chief complaints and some vital signs, and so now I'm over into kind of the tab that can be very helpful for the doctor, the this visit activity, they call it, right? And this activity has all these different hyperlinks. So you can either scroll through or learn to use the hyperlinks. And, I already know that this patient's here for chronic disease. So it was put in here that this patient's chief complaints include hypertension, hyperlipidemia, diabetes, CHF, obesity. All right, so we've got these chronic disease that need to be updated, reviewed for this visit. So that gives me an opportunity to use my Chronic Disease Management SmartSet. Now, if I've already searched for that SmartSet or saved it into my favorites, then I can, from this visit, I can jump to the SmartSets area, and it will give me a listing of my favorites and any ones that I found in recent searches. Okay, if I was going to find it fresh, then yes, I can come down to the plus, add order, do my qCDM search. There it is, my qSet chronic disease visit. All right, if you don't find it initially, click the broaden my search to search the full database. Let's activate the chronic disease visit SmartSet. Okay, so we got our SmartSet listing here. If I have some particular comments, those will be in asterisks up at the top. So this one says, okay, the key defaults, some things that are checked at default are there's going to be a 6-month follow-up visit clicked as a default, but you can change it. The care gap orders and the labs do orders, those will be pre-checked, as well as because this is a chronic disease visit, something you're likely being the primary longitudinal caregiver of, I've got pre-checked the complex care code, that complex G code automatically checked, so you don't forget to add that on to your visit. And you can change it. You decide that, nope, inappropriate, or it turned out to just be an acute visit, it can be removed. The other reminder here is to choose a level of service, right? I'm not going to decide your level of service for you, but the SmartSet will have the levels of service for you to choose from. All right, next section down, visit notes. So very similar structure to the previous SmartSet videos I've done. We now have an opportunity to pick a note type. Yes, you can come over to the notes area here and do the same thing, but I'm going to have to jump around. I'm going to jump over here, and then I'm going to jump over here. So this allows me to kind of, in an organized fashion, work my way down. What are the instructions here? It says, no diagnosis overview in the final note with auto-added visit diagnoses and the diagnosis-aware note. Okay, what does that mean, right? Well, in my previous videos, I spoke about how the Epic assessments, they can, when you have something on your problem list, it can have an overview and it can have an A and P note, which is just like the old Allscripts description and impression, right? A description is static, stays still until someone changes. You don't get a new one, but you can edit it. It's just one entry that can be edited over time, whereas the impression is a new box every time. With Epic, overview is that one static, just like the description. A and P notes, new entry every encounter. All right, so the overview, sometimes you really want that to show in your note, but there's sometimes limitations with certain note types, and definitely this newer diagnosis-aware note type that has some good features. It has a lot of good features, but it doesn't pull in the overview of the diagnosis. So if you really want that in there, you're going to have to use a different type of an assessment note type that will pull that in. So that's one thing. And then this SmartSet is attempting to help you not have to click as much on those chronic disease diagnoses. It's a little tricky, but it assesses the chart whether you have certain specific ICD-10 codes. And if this patient's problem list has certain ICD-10 codes that are chronic diseases, then it will pre-check those as visit diagnoses. All right, so for this test patient here, I've given this patient all of the relevant diagnoses to kind of demonstrate. Right, and so here, this patient has an uncontrolled diabetes code, E1165, chronic heart failure with reduced ejection fraction, I50.22, atrial fib, and on down. I have vetted this out with the testing to make sure that when it selects this visit diagnosis, it's similar to what you have on your problem list, but it's not going to trigger those extra steps of specificity for the diagnosis. All right, so by activating one SmartSet, even if I had just 3 or 4 of diagnoses to assess, it's doing it for me. I mean, the numbers in my head of how many clicks I'm going to save visit after visit becomes pretty astounding as I get the benefit of this. All right, but as I mentioned with the diagnosis aware note, also, even if you did use a note type that pulls in the overview, these auto diagnoses won't pull in the overview. It's almost like you're putting on a new diagnosis to the chart, but it's the same diagnosis. It's just only a visit diagnosis, not going on the problem list. So it doesn't pull in the overview notes. All right, you'd have to kind of go without those or uncheck it, get that item, and then add it from the problem list instead. If I add it as a visit diagnosis from the problem list, then that would pull in any overview notes that I have. So what that is, call out that limitation. But in many cases, I'm fine. Most diagnoses don't need a description. There might only be certain cases. And this, I will show you within the note type that we have also a little solution for that if you're for some details. All right, so that's a key difference from the other SmartSets I reviewed, because those SmartSets, the diagnoses for an annual wellness visit and an annual physical are pretty standard. I don't have to use any special logic to know what those Z codes are for those, other than is it a new or established, or with the wellness visit you have to choose whether it has abnormal findings or normal findings. But with this one, we have some of these top chronic diseases that we can help get into the assessment automatically rather than having to click on each one. Now, obviously, if you don't think you're going to be assessing one of these that's on their problem list, you uncheck it, and you'll get the opportunity to do that anywhere. All right, so as we work our way down this chronic disease management SmartSet, we see I have some wellness instructions built in here. All right, so from the key things of kind of exercise, weight loss, diet, tobacco cessation. I mentioned the visit charges. So here's where you can choose your visit level. If by some chance it was a new patient, even though it's a chronic disease visit, those are in there, established or new. Here's that complex care code. Pre-checked. Follow-up visits, I mentioned it will be pre-checked for the 6 months, but you can switch that up if you want, or maybe their next visit is going to be annual wellness or annual physical, or you just want to customize to some other follow-up. Right now, this is set up as a choose one only, as opposed to a multi-select. So if you did want to do multiple follow-ups, you'd have to do one here and then add one separately elsewhere for a follow-up, either through the orders, or again, I'm not sure how this follow-up area works. If this this visit, whether this shows up in your note as well. So we'll try that out. We'll put a statement in there about annual wellness visit in 3 months. I'll see if that shows up anywhere in the note, because I just don't know. Hadn't tested that out yet. So I'd get back to my SmartSet. All right, so now we get below the follow-up. Now we're into the areas I've already gone over in the previous videos. Here's the labs due. All right, so labs due based off of the patient's chronic diseases, diagnoses, medications, and previous abnormal labs. It's giving me a listing of what labs would be due. I can click the header to get the details. Tells me, oh, here's the diagnoses that are relevant. Here are the medications that are relevant. Here's the abnormal last labs that are relevant in abnormal last vital signs. And then I can access, as I've demonstrated in the previous videos, either a pop-up of the last QDOs, 3 of them, or go to the full results review tab on the chart. Then in each item that's ordered, it will give you even more information down to the level of if there were previous labs done, it will tell you, such as the last blood pressure, here's the last A1C with the date, here's the most recent BMI. So no change here. This is all the same as previous review. Then as we get below the labs due, we have health maintenance. So this health maintenance is configured to not repeat things that the labs due is already doing. And you'll notice from the things that it ordered, there's definitely things over in the care gaps that it did not order. What kinds of things did it not order? It didn't order things related to vaccines. It did not order certain diabetes items, knowing that you have to kind of decide for yourself with the patient where they go to get those items done, as opposed to ordering. You wonder also, flu vaccine. You think, chronic disease visit and it's flu season. Why would I not put the flu vaccine in here? Well, many times I don't know which flu vaccine at that moment we have in the office, which one's private, which one, the age-based ones, and our nurses have the protocols many times of doing the flu shot. So I felt like putting a flu vaccine in here generically would just make me have to uncheck it. Wouldn't be used. So that's why I've kind of made some decisions on within the SmartSet, not throwing every single item due in here, but just those relevant items that are related to our Medicare and HMO quality metrics, and those ones that the physician can truly choose. I know what order I need. Many vaccines we are kind of least I am, relying on the nurse to tell me which one. If you need me to put the order in, I got to go ask them which one. If they can put in the order per protocol, I'm going to leave it up to them. And when they do it, it will close the gap. I don't need to close the gap from my SmartSet per se. All right, so another nice thing about the chronic disease SmartSet as we go down is I include other lab orders. You, as you're talking to the patient, you may decide you need other orders. Now it does give you, read the top, it says review the qDo orders before you decide what to click on here, because this doesn't, there's not an ability for the logic here to know what you've already ordered. This is just a listing, and so it won't know that you already ordered it up above, because it's not even really ordered yet. It's pending. It's just checked, awaiting you to decide it to pend it or order it. So you'd have to know what was ordered above and then decide what else you might want to add. Over time, you're going to kind of know what those ones are, or more importantly, you're going to know which ones in here aren't in the qDo. All right, we know there aren't really any cultures in the qDo, and there aren't any of the some of the more advanced type tests of inflammatory arthritis or otherwise. So those are in here in this SMART group. Now, what about within that chronic disease visit if they are acutely ill? Well, I pushed point of care tests down to the bottom. So yes, it likely is not going to be the thrust of the visit where I would put those POCs towards the top, but they are in here where you can get to that area and not have to search to order those POC tests that you might have in your office. All right, so besides other labs, I also have an area for other diagnostics. So yes, you decide you did want to get something like you have your x-ray equipment and you want to get an in-office chest x-ray or an out-of-office chest x-ray at different sites. Maybe you need an echo, spirometry, PVR testing. So just put some, or office spirometry or EKG. So put some of those other diagnostics in here. Not a comprehensive by any means. The moment you think you need something more, definitely use your add order or your favorites, right? Where you got your different favorites areas to order what you want. So I'm going to go back to the top here because I'm going to put this note in place. All right, so I decided, I want to use the diagnosis aware note. You'll write the DAN notes or POC, problem oriented charting. So you'll hear it said multiple ways. I'll keep on saying that in these videos to kind of get you get awareness of that. The newer style of Epic note that puts more context of the diagnoses in your assessment and allows it to capture what you type under the assessment. It captures it as an A&P note automatically to be visible from the problem list on future visits. All right, so I'm going to click my add now for that. I'm going to add that note. The diagnosis aware note is an APSO format, so it puts me right at the top. Okay, so now I had already put one diagnosis on my problem list, but you'll see there's none others. Why is that? Oh, because I hadn't actually fully activated this yet, right? So that's one thing, is that I can add the note, but I'm not going to start to see these diagnoses until I actually activate the SmartSet. And you'll notice I have this little red stop sign. What is that? I think that's the billing, right? I'm hijacking an encounter that was not mine, and so it wants me to confirm who the billing provider is for this. I can now sign this and give you a little bit more information on the visit note over here, okay? So I wanted to focus on the note a little bit that we added. We added a diagnosis aware note from the Chronic Disease Management SmartSet. And that note type has a certain assessment and plan section. And I've maybe mentioned this a little bit before, where the DAN, the Diagnosis Aware Note Type, will structure the information a little bit differently, where it gives the assessments a different color, this green color, and then the primary diagnosis will have the diamond, and that the primary, if you change the primary diagnosis, you can move it up or down, move diagnoses in different orders that you might want. As you hover over the diagnosis, it lets you grab it and move it once you get to another diagnosis. Really, the primary diagnosis is what matters for the billing part. The diagnosis that's going to be the most risk to the patient that you assessed. So the diagnosis aware, and really I did some searching, most of the assessment abilities to put an assessment in your note, other than just typing it out yourself, most of them will put all the orders underneath. Even if a lipid panel is ordered for both the hyperlipidemia and the diabetes and the coronary disease, it's going to list that order item under each of the diagnoses with most of the notes, the foundation notes that I've seen. So this is no different. And this is a complex visit because it's been used multiple times and it's got a lot of orders. If you recall, the SmartSet, we did add all the HM do orders, the labs do orders, and this patient has a lot of diagnoses, so it's going to look a lot busier than most notes are going to look. And remember when we did the diagnosis association, see, I can even get back to that. I can get back to the diagnosis association and see this patient has a whole bunch. So this is what's making the assessment and plan so busy with so many diagnoses and so many orders. So a little bit of time spent configuring this on your visits will make your note look more concise, nicely broken out by problem. Just to know, you can use that associate diagnoses area to clean this up. If the only reason I need a hemogram is for the atrial fibrillation and the chronic kidney disease, then I can do that. I can get rid of these others with lots of extra clicks, but you can clean that up so that then now in my note, you saw a little change there that, okay, now the CBC is now only associated to the chronic kidney disease and the atrial fibrillation somewhere. I thought I may have missed it. There it is. All right, so how did I get there? I went back to my signed orders area, associate signed orders, and I'm able to fix and clean that up. But you could have done it on the front end. On the front end, when you were going to sign the orders and it forces you with this screen, you can set those orders up properly. So what else could I do? Right. Well, let's say I was like, nope, I don't like it. I know I need all those orders in here, but I need it to look different. I need it to look different. Well, one way to do that would be to kind of start the note from scratch with a note type that works for you. If you hadn't found a note type that works for you, you can add sections. I can say, okay, I'm just going to remove that part that I don't like the way it looks and type it out, or use M-modal manually. Or there are some smart links that can help you here. So let's say I just want a bulleted list of the diagnoses. Well, .dx, add it to your favorites. This gives you a short bulleted table list. Yes, it's a table. So some people may not like that, but it is just a short bulleted list of all the visit diagnoses that somehow were either marked as a visit diagnosis or were linked to an order during the encounter. Well, maybe, but now I don't have the orders anymore, right? Oh, so how can I also get the orders? Well, then I can do SmartLink, ENCORD, name only. This one looks like it would be good, but it puts all the details of each order regarding dates and questions. This will make it long again. This one, it is pretty simple. It doesn't tell you whether it's a future order or a current order, but basically that really long assessment and plan, now I can just have a listing of my diagnoses with my primary and then a listing of the orders. Some people really like the notes structured that way. And so you can build your own smart phrase. I can now select this the way this note is because I made that change. Right click, smart phrases. Create smart phrase from selected text. Continue. Now I can make my own note from that template I've given you, the diagnosis aware note template. You can now customize that to say, well, I like that. Okay, I like most of it, but I want my assessment and plan to be the more simple, a list of the assessments and a list of the orders. And so now that's what I've done here. I've made those changes in the note. Now I'm going to save it as a smart phrase, and it already pulled in. There's the .dx, there's the .encordnm, and then everything else would remain the same. Everything relating to the history and the meds and the exam and the results that would pull in further on down, this APSO note remains the same, but this was now changed to, instead of the diagnosis aware assessment and plan, it's now just a plain old table listing of the assessments and a bulleted list of the orders. So I can give it a name. So what am I going to call this? Maybe it's an APSO note, and it has a simple assessment plan. So I'm going to call it APSO SMPL AP. APSO Simple AP. There's my new smart phrase. And voila. Everything else about that note template remained the same. All the other features remained exactly the same, but I made a little edit to how the encounter diagnoses show and how the orders show. And you could do this on the fly. You can change, on the fly in many cases. There's some issues with the A and P notes. If you try to delete a note and then start a new one, it may duplicate. But this kind of change works nicely. And I got myself a nice new smart phrase out of it for a different type of note. The note I chose needed a little adjustment. Now I can do that and make this more concise. So that's the little bonus from this Chronic Disease Management SmartSet, right? qCDM. There it is right there. Right click. I can add the favorites. Now, when I go to my little favorites button next to the add orders, there it is right there. There's my favorite. Along with all the others, the videos cover these other items. What's the last little bonus? One last little bonus, huh? Well, the last little bonus was alluded to in the SmartSet. Under the diabetes diagnosis, there was a little note that said, use qAIDM SmartLink for HPI of diabetes. All right, so see, qAIDM, this is a smart link that will enter some kind of logic AI-based smart text for a brief diabetes history update. All right, so I just added that in, and this is what it's going to put in my notes. Patient's diabetes diagnosis was reviewed. Hemoglobin A1C, the last one was greater than 6 months ago, and it was 6. The microalbumin ratio, there was none done in the last 10 years. Complications, this patient has diabetic nephropathy. Medications, no current diabetic medications noted. All right, so nice little extra way of, I can be searching around the chart for information and get that in my head and dictate it. But there are features within Epic that allow us to pull most of that information. Is it going to get everything? Or likely not. There can be some diagnoses. If it was just a visit diagnosis and not a problem list item, it might not pull in. So, but if this gets me even 50% of the way there, this is great time saver to get this kind of information in my note in a prose type format that I would typically do anyway, and be written ready for me to work on some other things. So unfortunately, with time being short, right now this is the only one that's available. Don't have one available for any of these other chronic diagnoses like the hypertension or hyperlipidemia or CHF. But basically want to see if this gets used, if it's something that people value, and if so, then more efforts can be put into creating and tweaking these to give us some really very quick ways of pulling from Epic, bringing the information to us with quick commands rather than having to constantly search in multiple different places for disease-related information. Lots of ways that Epic is doing this now, especially with this what's called the synopsis. Those, I think the synopsis views will also help with that, but they don't get it into my note, right? I still have to go to the synopsis tab, and then, they have these kind of disease-related items. I can go to the diabetes synopsis, and it's going to give me some great information here, but it's not in my note, right? I still got to put it in my note if I wanted the value of documentation there related to that. So qAIDM, that is the trigger smart link. And that will pull into note. It doesn't have to be in the smart block, right? I showed you entering it here in the smart block, but you can do it straight into the subjective HPI section of the note. Take care and have a great day.